Now here's Mike Trim with Ask the Doctor.
Coronary heart disease is the leading cause of death in the United States for men and women. Men have a greater risk for the disease and heart attacks earlier in life than women, but that changes after menopause. A survey by the CDC found doctors are missing important opportunities to prevent coronary heart disease in women. Dr. Seth Baum joins us now from Boca Raton Regional Hospital. What the hospitals do to working to change that, doctor? First of all, thank you so much for joining us.
Thank you for having me.
Let's talk first about the Women's Preventive Cardiology Program at the hospital. Expand on that a little bit, sir.
Okay. Well, first of all, I'd like to say it's a great opportunity for women in our region to have a Women's Preventive Cardiology Program. And I think I need to acknowledge those members of the hospital who actually created this program or helped create this program. The CEO of the hospital, Jerry Fideli, the CMO, Dr. Charles Pasternak, then the head of the Christina E. Lynn Women's Health and Wellness Institute, who is Dr. Kathy Schilling, and the executive director of the program, Liz Linden. What they recognized was that women's health extends far beyond breast health. Although breast health is certainly very, very important, more women are dying from heart disease than breast cancer. In fact, about 11 times as many women die of heart disease as breast cancer. So what we've done in the Women's Preventive Cardiology Program is we've established several goals. And the first goal is to increase awareness of cardiovascular disease in women. And you did mention that more men die than women.
Right.
In fact, actually, if you look at the grand total figures, ultimately after menopause, all things considered, more women are dying than men from cardiovascular disease, and more women are having strokes than men. So it's taking a terrible toll on women, and we're going to raise awareness. We also have the opportunity to evaluate many, many women, and by risk stratifying these women, we can then treat them more aggressively and prevent cardiovascular events.
Bringing other patients into the fold here with this program and treatment at the hospital there. It's a common knowledge, you know, that obesity can lead to heart disease, the obesity epidemic in America. What can you say about those at risk with that problem?
Oh my God, as you know, it's a growing problem. 2/3 of Americans are currently overweight. 1/3 of Americans are obese. It's just a huge growing problem. If we don't do something about it, we're going to reverse the gains that we've made over the last 10 years. So we need to do something substantial. That affects women as it does men. Getting back to women, there are other, and again, this translates to men too. We wanted to focus on women because women are not focused on enough. Women are often undertreated. Women are treated for diabetes, for hypertension, for lipid disorders less well than men. So we need to correct that. We need to educate physicians as well as patients, and to that end, I'd say Boca Regional is extraordinarily fortunate in that we've been chosen to host the first annual Southeastern Conference on Women's Preventive Cardiology that is sponsored by the American Society of Preventive Cardiology. It's a great opportunity. We have professors from Harvard, Mayo, NYU coming down, I mean, all over the place. So we're going to do our part with that.
A group effort. Dr. Baum, thank you so much for joining us today here in Boca Raton Regional Hospital. Sponsors our expert and underwrites our Ask the Doctor feature.
Ask the